to you about emergency phone calls. I recently changed my last name, so do not be fooled. I am now Amber Sullivan. So we have about 10 doctors at ICM, and we take the emergency pager for a week each. And as a first-year resident, I was taking it for the 3 owners. And then we had like 1 or 2 doctors go out on maternity, so I was like on call like at least a third of the year. So yeah, so I'm going to talk to you guys about that. One of the things we did when I first started, so like the first 3 months-ish, I, of course, discussed with my supervisors how they wanted me to handle these phone calls, and I always made sure that I was contacting them when I did receive a phone call, make sure, debrief them, make sure I didn't miss something, because I think that's really important. And then as the year went on, I didn't always need to do that, so I did that, of course, when I needed to, but things got a little bit smoother as the year went on. So we're going to kind of go over all this stuff here. Generally, when I receive the phone call, I always like to let it go to voicemail first. We have them go right to our cell phone, so I have the message on my cell phone. I let it go to voicemail for a couple of reasons. One is because then I have some time to do some research. I can take a look at resources and like look through up-to-date or whatever I need to do. And then it weeds out a lot of non-urgent matters. Because we have the 10 different doctors, I don't always know these patients that are calling, so it gives me time to actually look through their chart. I look at like, when were they last in? Were they in on Friday, or were they in a year ago? Are they just trying to avoid coming in for a visit? So sometimes I end up like scheduling them to come in. And then typically what I would do next is just call the patient back at a really good HPI. Check in on medication supplements. Always ask about allergies, because I feel like if you do need to prescribe a medication, sometimes allergies aren't actually up to date, or maybe there's a new allergy you didn't know about. And then at that point, I will often contact the provider. So if it's something really urgent, I definitely contact the provider. If it's not necessarily all that urgent, I make sure that I rope them in at some point. So once everything is kind of tied up, I send them an email and I say, hey, your patient called, this is what we discussed. And then everything goes in the chart. So maybe you had to call the patient like 3 times. So you call them, you document the time, you document what happened. If you send them for imaging or urgent care or whatever, get it in the chart. And then when I return the call, make sure you know what your phone tree actually says, because it may not actually say, like, if this is an emergency, call 911. So you might be getting phone calls. You need to kind of know who's actually going to be calling you. And then when I return the phone call, I make sure to say, this is Dr. Sullivan returning your urgent page, because sometimes they say, oh, oops, sorry, this isn't an urgent matter, and then they kind of realize, oh, I could have just sent an email to the doctor, and then, they apologize, and that's nice. And then common calls, so I don't know what it was last year, but I got a lot of UTI phone calls, like sometimes like 2 a.m., like, really? Okay, 2 a.m., all right. You've had a UTI probably all day. Could have called me a little earlier. Okay. Cold and flu, sinus, that stuff is always kind of going on, especially this time of year. And then a lot of gut stuff, so people will have like acute diarrhea, vomiting, maybe it's gastroenteritis, maybe it's an acute abdomen. That's something that you really need to figure out, like maybe they really do need to go to urgent care. Skin rash, I got a couple calls about that. Drug reaction, this can be supplement too, so that's another reason looking through the chart's really nice, because you can see, oh, they were just given this new supplement or a new medication, and then they're calling you and they're saying, like, I feel really dizzy and weird, or I'm having this diarrhea or whatever, so you need to know kind of what to do about that. Post-procedure or IV complications. So anybody that is doing procedures, I know a lot of us have IVs, a lot of other procedures, injections. One of my first phone calls, I think it was my first phone call actually, was from a patient that we saw in our Saturday clinic, and we did a high-dose vitamin C IV for her. Like 6 hours later, she calls me, and I was happy that I was actually the one in the clinic with her, so I kind of knew what was going on with her case. But she's like, I have a lot of pain at the site, and it's like really irritated and red, and it feels hard, and I was like freaking out, like, oh my God, what's happening? Does she have this like terrible infection, or is there like a catheter embolism or whatever? So I kind of come up with my DDX, and then I call Kelsey right away. And I was like, here's what's going on. And then really he had to take over the call because they were back and forth like all night. It turned out to be just really bad phlebitis. It's like all the way up her arm. She was sending photos. It was pretty scary. But then she went to urgent care, and they were like, yeah, take some NSAIDs, put some heat on it, right? Like, you're fine. But that kind of stuff will definitely happen if you're doing procedures in your clinic. And then peds, we don't do peds, so this is like a whole different talk for peds, but you'll probably get a lot more phone calls and a lot more urgent matters. But thankfully you have Lauren's fantastic slides. So and then drug refills, so that's a little bit of a pet peeve when people call me for a drug refill, because they're usually not urgent. Unless it's like insulin or something like that, but most of the time people are like, my progesterone's low. And I'm like, okay, yeah, all right. So we get, every once in a while that happens. I try and educate them and let them know that this is for urgent matters, but usually they feel bad. And then as far as like deciphering the level of urgency, I have one of these books, but I think this is a nice reference because you can get on up to date, but it's like 30 pages of really complicated text. I think that the Rosen is a pretty good book, but it's like $120, so I didn't get that one. But it would be a really nice reference to have in clinic, or if you're going to be on call a lot, you just open up to one page and it's like all the HPI you need, has physical exam in there, so you could use this in clinic too. And then any kind of follow-up, different imaging that you might need to order if you really need to send them to urgent care or to the ER. So I think it's really helpful to make really quick decisions. And then there's the pediatric one too, which I think is useful.
The 5-minute emergency medicine, you can get the 3rd edition for less than $5. There's not that much difference.
Really? Yeah. Because they're like over $100, most of these, for these little books.
I think several of those are on Kielwa.
Yeah.
We get for free with our license.
Yes. So there you go. And then, of course, this is an algorithm on UpToDate, which everybody has seen.
Or?
Yeah.
Oh yeah, you probably don't get that.
It's California.
Oh, yeah.
Free posts and journals that we have access to for our license.
So this is a very famous UpToDate algorithm that I'm sure you've all looked at many times. This is for cystitis, just simple cystitis. So of course, if you need to manage an antibiotic, or if somebody's, if you're planning to prescribe an antibiotic, or if the other treatments have failed, this will help you decide what you need to do next. And then it's not always just the patient that calls you. Often it is, for me it was, but a spouse could call you, or a parent can call you. So you just need to know that legally you should have a documented release to actually discuss the protected health information with that person. And if you don't have that on file, you can get a verbal, but just make sure that you document that. So just something to think about. You may not really be thinking about that at that time, especially if it's something that's critical that's going on. And then radiologists and lab techs will call you too if there is a critical finding, and generally these are usually pretty urgent, and you need to contact the patient right away. I always contact the provider, whoever was seeing the patient, and let them know what's going on, and often they take it from there because it's their patient. And then a couple of tips. So if patients are calling you in the middle of the night, one of our doctors was telling me a story about somebody who I think had a UTI, called her at like 2 a.m. and said, well, I think this is what's going on. And she said, well, I'm going to call in a prescription for you. And she said, no, just my regular pharmacy, I'll get it in the morning. She was like, oh, okay. And then, of course, the patient called like 2 hours later and said, never mind, please send it to the 24-hour pharmacy. So just send it to the 24-hour pharmacy if you know you're sending in a medication. And there's one in Queen Anne. They're really hard to find for some reason because they say 24 hours when you're looking for them, but it's not the pharmacy, it's maybe the whole store. There was one, is there one on the east side? There was one in Kirkland that
Walgreens used to be, I don't know.
on
it's,
85th, they're not, I called them.
Oh, okay,
Yeah. So it's always a good thing to know where to call. And then wisdom from Dr. Selmer here. She said, I thought this was actually really important, that, you know, patients are calling you, most of the time they think that what's going on is urgent. They don't know, that's your job. But often they're scared and they want to talk to you and they want to make sure everything's okay. And if you show them good customer service, they're really going to be happy with you. They're going to be happy with clinic. And they're really going to want to keep coming back. So that's pretty much all I have. You guys have any questions? I know that was kind of fast.
Can I add one more
Yeah.
reference?
Yeah.
Which is the Seattle Children's website. It's their symptom checker is how they have it listed on the website. It's awesome. It's the same as the Schmidt protocols that you may have used in school, those pediatric telephone protocols. But the whole thing is on the children's website. You can just hop in there and do like head trauma, call 911 if, see your doctor within 24 hours if. It's the whole triage protocol. It's really awesome.
Oh, that's great.